welcome as well. Thanks for joining us. If you have any questions, please put them in the chat there for us. We'll do our best to answer everybody's questions. And any questions we don't get to by the end, we'll make sure to send them, follow up through either phone call or email with everybody. Awesome. Well, why don't we get going? All right. So welcome everybody to, I'm Nick, the owner of Human Integrated Performance. We've been open about a year and a half now, officially. And I'm an avid cyclist myself. I have a road bike, a mountain bike, and a fat bike. So I love cycling, and knee pain has been something that was a big problem for me. So I really wanted to make sure that we sort of shared some of the stuff that's helped me out with the cycling community. So welcome for joining our session here. Maybe if people in the chat, if you could just put in, think of a song that sort of describes how your day's been going or how you feel today. So I had it just playing a little bit earlier. It was Bicycle Race from Queen was on my, was playing just because it's been sort of in the fun day and getting prepared for this. It's our first one running this on Zoom. So any feedback you guys have would be really, really appreciated. We'll look for some in the chat here. What are some people saying, are they finding with going thing, how are things going? So where is my chat? There we go. Awesome. All right. Sunny, sunny day. I love that. Awesome. It has been a beautiful day. Thank you, Diane. All right. So well, let's get going. So again, officially our how to fix knee pain from cycling. We have myself here. I'll sort of be coordinating everything on the computers here, and then we have Nisha, our physiotherapist at the clinic, and we're joined by our motivator from Yeg Cycle, Katie Chamberlain. So she's gonna give some information on just what she sees in some of her cycling classes. Nisha will be giving some exercises and really the expert on the knee here about what's been maybe is troubling you and how to get some help to fix it up. So hopefully we can answer any questions. If we don't cover it, I know there's some people that aren't necessarily cyclists that have joined the webinar today. So just because what we're talking about is based on cycling doesn't mean that that's the only thing these exercises will be necessarily beneficial for. So I'll turn things over to Nisha.
Thank you. Okay, so I'm Nisha. I'm the physiotherapy resident at. Sorry. It should be somewhere. Okay. Sorry. Okay. So my name is Nisha, and I'm physio resident at Human Integrated Performance. So my journey as a physiotherapist started, I guess, so many years ago, almost 7 to 8 years ago. So my family background, I have my father who's a acupressurist and my brother who's a physiotherapist. So those people inspired me to get into the field of healthcare. And then when I was like maybe in 2012, after finishing my high school, I decided to go and make my career in the field of physiotherapy. So that is how I started. Then after completing my graduation, I started working in an orthopedic hospital where I worked with patients who had knee troubles, like who had undergone major knee transplantation or knee replacement surgery, people with ACL, PCL, some ligament injury in the knee joint, and then I worked closely with them. After about a year's experience, I decided to expand my horizon and then, look forward for different opportunities. And then I decided to come to Canada and work here as a physiotherapist. So that is how it all started.
Awesome. Awesome. So if anybody wants to put in the chat, what would be, if you didn't have any knee pain right now, what would you be doing? So for me, I don't have knee pain right now, luckily, because I've been doing my exercises, but if I didn't have knee pain, I probably would, at the time, I would have been cycling a lot longer. It was the distance that was giving me real troubles. And even walking upstairs became a real issue for me. I think you'll probably chat about that. That's a common thing. So for our attendees here, what are, in the chat, if you could put in, what are some things that you would be doing if you didn't have knee pain? Whether it be like going on longer rides, riding more often, sleeping better for some people.
Yes.
I'll sort of wait for that to pop up for some people. No one's too excited to put in stuff in the chat today. That's right. We'll keep going. There's troubles. All right. So, and then one of the things, what's the most frustrating thing about knee pain? Well, I think for probably most cyclists, I suspect the most frustrating thing is they can't ride their bike as often.
For a long time. Yeah, mainly like some people usually come up with like if they have to go up the hill, they have trouble going there. But if they have to like ride for long distances, that could be one of the major troubles that they face. Or maybe some have pain after the ride, so like they can push themselves all the way to like finish the whole ride, but like they get the nagging pain after the ride is finished. Right?
Katie, what do you find is the most frustrating thing for maybe when you're in your spin classes that you maybe hear complaints about when they're injured or their knees are giving them troubles, things along those lines?
I think the main barrier for riders in the spin classes is the frequency that they would like to ride, and they're unable to due to knee pain. So I think a lot of people are wanting to go to classes, maybe between 3 and 5 times a week. But if their knee is aggravating them and it continues to flare because of the same ongoing issues, they're unable to do that.
Yeah. And Nicole just put in the chat here that she doesn't necessarily have knee pain with cycling, but she's getting with running as well. I think a lot of these same exercises we're going to talk about today will be helpful, whether it be cycling or running. Yes. Good. So having and with Diane, she hasn't been to a spin class since she injured her knee. So you're at the right place, Diane. We're going to help you out today. That's great. All right. Well, let's keep moving. So the 3 most common causes of knee pain when you're cycling. So I'll let the expert sort of do her thing here.
Thank you so much. So one of the major causes of knee pain is, I guess, the iliotibial tract friction syndrome. So many people do not know what iliotibial tract is, but like from the presentation, you can definitely see like where it lies. So I would like to show it on myself. So if I am standing, should I go ahead?
Yeah.
Yeah, maybe.
And if you can't hear Nishla, because she's fairly soft-spoken sometimes, so if you can't hear her, maybe just put it in the note or in the chat there, and we'll make sure I'll bring a microphone closer.
Okay, thank you. So basically the iliotibial tract, it extends all the way from your pelvis and it goes up to your shin bone, somewhere about like just below the knee joint. So it runs all the way down. So if there is any tightness in the band and if you have to like do constant knee bending and straightening the knee, so like we call it like knee flexion and extension. So when you have to do those kind of movements a lot, it causes like friction. So your iliotibial tract or iliotibial band rubs over your thigh bone, the femur, and that usually causes irritation or maybe so it also causes some tenderness. And this kind of pain is basically seen on the outer side of your knee, or also called as the lateral side of knee. So that's one of the major, I would say, cause of knee pain in patients who come with complaints of knee pain, who run, walk, or maybe are involved in any kind of sports activity. So that will be the number 1 cause, I would say, Nick.
And so I know I've been involved. I'm a psychologist, but I've worked as an exercise therapist before I became a psychologist. And one of the most common problems people would have would be IT band pain. And one of the things that when they would get this syndrome happening, everybody starts getting out the foam roller and rolling just up and down their thigh on that roller. And apparently that's not necessarily the best thing to be doing, is
exactly.
it?
That's the one of the, you can use it to relieve the tightness in your IT band. And that works the best, I would say. Yeah.
Right.
From my
so does anybody else get that IT band problem here at all? Did they find that their IT band gives them issues either while you're running, walking, or on the bike at all? It seems to be a bit of a delay in the chat, so we might move on. So if you have questions about that, okay, perfect. So Nicole, that's exactly what she's getting. So we'll have some exercises and some stretches today to help out with that.
Yes.
And then we'll talk a little bit more at the end, but everybody will have the option to have a free virtual assessment or in-person assessment with Nisha, just to get a bit of a mini assessment done, or a consultation done rather, and sort of review what might be going on and some strategies that might help out. So awesome. All right. Okay, number 2.
Okay, so the number 2 is patellofemoral joint inflammation. I know the name is like too big and can be quite confusing at times, but here in the presentation you can see where the kneecap, or it is also called the patella, so it usually follows a track when you bend your knee or straighten it. It usually follows a specific track or path. When it is deviated from that, it rubs on your thigh bone, and that usually causes inflammation or pain. And this kind of pain is usually felt anteriorly or maybe in front of your knee joint. So this is how you mainly differentiate whether it is the IT band or is it the patellofemoral pain syndrome. And there are various reasons why you feel that. So
actually, just go back 1 second there.
sure.
So you have on here the patellar tendonitis. Can you
Yes.
talk a little bit more about that? Because I think that's something that we hear like tendonitis a lot and
Yes.
patellar tendonitis very often in the medical world, but what does that actually mean for our
Sure.
attendees?
So tendinitis, itis behind any word mean that there is some inflammation. So there is a patellar tendon or maybe the muscles in the front of your thigh. They all combine to form one common tendon, and that is called the patellar tendon. So when your kneecap or your patella rubs on the femur or maybe your thigh bone, it also damages your tendon of your um, muscles of your thigh called the patellar tendon. So that then causes tendinitis. So there is accumulation of some of the cells in the body that causes irritation. There you feel some swelling, there is redness, and when you try to touch it, you feel the warmth if it is an active tendinitis case.
So I'm guessing, from my understanding with bikes and even with running and walking,
Yeah.
so if we see someone biking and their leg is sort of moving in this circle side to side,
Yes.
that's probably going to irritate some of that.
Yeah.
Or with runners, if we see their knees sort of collapsing in, a lot of
Correct.
times that will cause that also as well.
Yeah, mainly.
I'm sure there's other reasons, but,
Yes.
but that can use some of those. Hey? Okay,
Correct.
perfect. So again, if anybody else has that patellofemoral pain in the front of your knee,
Yes.
right, and it gets hot or it's warm to the touch,
Yes.
then you can put that in the chat, and we'll make sure that we kind of address those specific problems for you when we follow up.
Sure.
Okay. Excellent. So
these are some of the causes, like reasons behind the patellar tendinitis or maybe the patellofemoral joint inflammation. So one of them is weakness in the VMO. So as I mentioned, like there are muscles in the front of your thigh. So there is one specific muscle that is responsible for moving your knee from like completely bent position or maybe slightly bent position to completely straightening. That muscle is key muscle for that movement. So when there is any weakness in that muscle, it usually detracts the patella, and that it causes friction between the tendon and the bone. And when you get those tendinitis symptoms, then inefficient pedal stroke, we all already talked about that. Overtraining or improper training, obviously if your muscles are weak or if they have not been, like if you don't perform enough warm up before you ride your bike, it can lead to those kind of troubles. And overactive biceps femoris, so there is one more muscle that runs all the way from your hip to your knee, and if it is tight, it deviates the whole mechanism of your lower limb or maybe your leg, and that can also lead to pain in your knee joint.
So you're saying if I show up for a spin class and just start going at it and don't warm up, that's
not true. That's that's the wrong thing to do, I would say.
Uh-oh. And of these, is there one that you say is probably the most common kind of cause for that patellofemoral syndrome?
I would say like weakness in VMO, because that is one of the key thing that it's not common just in the runners or bikers, or it's mainly seen in most of the individuals.
Right.
That weakness in that muscle leads to pain in the knee joints.
And later on, we have an exercise specifically for that.
Yes, we have
muscle.
that.
Awesome. Fantastic. All right, and then number 3, we find that there's just when the bike's not fitting very well, that can be a real challenge and an issue, right? So, Katie, can you maybe speak to when you're teaching a class, what are some of the things that you remind your riders of fitting their bike to make? I mean, we're not going to go into a full biomechanics assessment on a bike here, but what are some of the key reminders that you instruct your students to do when they're getting that bike set up?
Yeah, so the key things I'll speak to in regards to knee pain are primarily focused on the seat height. So if I had a first-time rider in a class, a good indication of where the bike seat should be, the height of it, is if your shoes are on, it should be the top of the hip bone. And that isn't a hard and fast rule, but that's a good place to start. Once you're clipped into the bike, when you are at a full rotation, so your foot is at 6 o'clock, so the very bottom of the revolution, you want a 25 to 30% bend in the knee. So you don't want to overextend it so it's completely straight, because that can be painful for the knee. And you don't want it to be too high, because that's also problematic for the knee. And I would say the most common source of knee pain that I see in my classes is because people want to ride with their seats too low. So their knees are just far too bent. The other thing is how far forward or back your seat is. So when your knee is bent, if you kind of imagine a line from the pointy part of the kneecap straight down, you would want that to be hitting about the ball of the foot. Because again, too forward or too back becomes problematic for the knee. So as far as setting up the bike, it all comes to the seat. I know for cyclists, you can adjust, like for road bikes, you can adjust with the cleats, the width, and that would have an impact on knee. But in the spin class, we don't have that. So those would be the main ones for us.
And you know, I think especially even for runners, right? Like having like the proper shoe for you can make a big difference. Your gait and your biomechanics can make a huge difference on all these sort of factors, right? And whether there be weaknesses or imbalances, I know you'll get all to this as we go forward, but there can be lots of weaknesses and imbalances that happen as well that we go through. There's so many, myself, you know, having the road bike, having the mountain bike and the fat bike, and you mentioned like the pedal width or on the seat there, Katie. Like on the fat bike, the pedals are much wider, just the way the frames are, and so that's when I first noticed that and the knee pain that started happening, right? And then, but I know the seat heights are so different on the type of bike you have, so that makes it almost like this moving target to try and find the right fit depending on the type of exercise. So, will these exercises that we're going to get today, are they going to help whether it's a spin bike, a road bike, a mountain bike?
Yes, definitely.
Right? It doesn't really matter, does it?
No, it doesn't.
And same for the runners as well.
So I just want to add one thing to what Katie said, that sometimes you realize later that, okay, your bike seat or the saddle height is like too up, or maybe it's too low. But then I would always suggest to like make gradual changes in the heights. Don't make sudden changes, because that may then aggravate the condition instead of like, you know, making you feel better. And when you are doing so, always make sure like you keep a chart, like, okay, for a week, I'll gonna, you know, lower the height to almost 1 inch and then see how much pain you feel. If it is getting better, that means you are going in the right direction. But if it doesn't, then means there is some trouble, not just with the bike, there is some trouble with your own biomechanics. So that is how you can differentiate.
That's great. I didn't know that. Diane had a question about adjusting the forward and back on the seat. Diane, hold on 1 second. I have a couple slides coming up that maybe we can talk a little more specifically about that for Katie. We sort of jumped the gun a little bit, which is perfect, because I didn't tell you guys I moved the slides, so that's my fault. Okay, so let's, so again, I think I would say almost everybody can sometimes have a fitting problem with their bikes. So a lot of times at the bike stores, there's not a full formal assessment for the bike fitting. Sometimes, you know, we got a big class, and we're just trying to get things close. So spending that time and recording what's working for you can be really beneficial.
Correct.
And same thing for running. If you're making changes in your running, your walking stride, keeping track of all that will be really, really important.
Yes.
Even I know for a lot of runners, for those that are watching, that even just knowing the mileage that you've done on your shoes and when it's time to change them up, that can have a huge impact on all this as well.
Correct.
So, and Katie, you mentioned the sort of the just the pedal being able to shift, even just on road bikes and mountain bikes. If you have the pedals that attach the clipless pedals, the float in the pedal can also impact, like how much it moves left and right can also impact the knee pain as well. So all these things are so many factors, which makes it so complicated sometimes. And why it's so hard to find that knee pain sometimes, or the cause of that knee pain. So, all right. So so we'll sort of refresh on this idea of the common mistakes when fitting the bike. So I know Diane specifically was asking about that forward and aft position. Katie, maybe if you could speak to that when it comes on. But this would be, I think, the most important thing is that people just sort of show up and they just ignore it, right? Sort of just, oh, I don't see it.
Yes.
No problem there, right? You ignore that knee pain, and it just ends up getting worse.
Yes, it does.
Right? And will these problems solve themselves on their own?
No, they will never.
And why not?
Because if a mechanism is incorrect, or if the bike is not properly fit, you injure your tissue once, you avoid doing that activity, then when you get back to doing the riding or maybe running, you again injure those muscles or the tissues, and that at times lead to a chronic problem rather than, getting it. If you just fix it in one go, it becomes easier to treat it as well.
All right, so that the wrong size or saddle position, or maybe the wrong bike, right? Sort of idea. So yeah, so Kate, can you just maybe go over again that forward aft positioning on the bike that you mentioned earlier?
Yeah, so the way I like to explain it, like the pared down way I actually do explain it in class, is when you have your knee bent, and where it should be is if you dropped a yo-yo, this is how I do explain it. If you dropped a yo-yo from your kneecap, it went straight down to the foot, the yo-yo should hit like the ball of the foot. So that's where you want when your leg is up in the bent in the upward part of the rotation. If your knee is going too far forward, that's problematic. If you're too far back, that's problematic. So you want to hit that sweet spot where the straight line down hits the ball of the foot.
And I think, again, like sometimes it's different. If you go to different places or different studios, sometimes you'll find they fit differently, right? So it's again, if you have your home bike might be fitted differently than the spin bike, then again, the road bike, the fat bike, whatever the case may be. So understand that. So hopefully, Diana, that answers that question for you as we go. So the wrong handlebar position. Right. So
yes.
Do you see this very often, Katie, at spin class, that people have the handlebars or they're position their hands on the handlebar in the wrong place?
Yeah. So this one, and Nishta, like you can jump in on this one too. I see that all the time. So it's in spin class, we are super conscious of protecting the lower back. So obviously not a knee issue, but cyclists like to have the handlebars way lower than we like to have in spin class. So like my gauge for handlebars is at least the level of your seat or higher. I prefer it a little bit higher because that hunching I find a little bit irritating. And you also want to be able to keep like around a 45-degree angle with the body so that you're not all like choked up and it's all close, and you're not too far back. Having said that, I know that's different for cyclists. They prefer to be lower and more crunched. So, I mean, that's spin specific talk.
And again, and it depends on that again. Yeah, which bike you're gonna do. Like the mountain bikes are gonna have them much more upright, and or like a hybrid bike. Like everything's gonna have a different.
Exactly.
I don't think there's too many roadies on here, but the roadies versus the time trialists versus the cyclocross people, they all have different setups for their bikes, and so it becomes this morass of trying to figure it all out.
Correct. And sometimes, like they say that your position of your handlebar should be comfortable for you. Like if it is comfortable for me with like 90 degrees to my body, it can be perfect for me. If it is not for someone else, that means it's incorrect for that other person, because not my body is same as the other person's body.
It's not a standard.
Exactly.
So okay, so we sort of talked about these sort of different causes with the bikes. We talked about sort of some of the different causes in the biomechanics that happen. So I guess what are this overall knee pain? Can you give a summary of how it's all causing? What's leading to these issues, whether it be running, cycling, even walking?
Yes. So as we already previously talked, like there could be some tightness in the muscles, or there could be some weakness in your muscles. And it's not just always about like specific to your muscles around your knee joint, but sometimes if your core muscles, the muscles of your spine, if they are weak, they have some issue. It can lead to some issues in your knee joint as well. So if your core or maybe the muscles of your hip, if they are not strong enough, they can lead to some biomechanical changes in your body, and that can also lead to some pain in your knee joint. So it all the slide already says that any weakness in your core muscles or any poor load transfer can lead to compensation in your knee joint, and that leads to problem. Muscle shortening is basically any tightness in the muscle, or that could be some contraction, which is not as common in athletes, or I would say, or maybe in general population, but that can also lead to pain in your knee joint. Stiffness of your knee definitely is, if you have had an accident before or maybe some major trauma around your knee joint, that can lead to some stiffness in your muscle, and that can also lead to some pain in your knee joint. And the postural alignment, we have already talked about it. Like if there is any malalignment with your posture, if your knee is not in the right direction or your kneecap is not tracking in the proper path, it can lead to pain in your knee joint.
So maybe just to, because we're going to go over the exercises here right away.
Sure.
So maybe just discuss then, just remind people about some of the key anatomy about the knee that are probably really important to help prevent a lot of these issues.
Sure, I will do that. So I usually have this habit of like educating my patients before I start on with any of the exercise, that before you do any exercise, you should know why you are doing that exercise and how it works. So here on the screen, you can see all the muscles in the front of your thigh as well as behind your thigh or maybe in your gluteal region. So you see, I guess, a muscle, they are all named differently, maybe they're not in English, but like there is one muscle that runs all the way from your pelvis bone or your hip to all the way down to your knee. Maybe if I can point the arrow. Yeah.
You can draw on it.
Okay, sure, great.
You just click and draw and drag.
Sure. So this is the rectus femoris muscle. If this is tight, it can lead to pain, the anterior knee pain, or maybe patellofemoral pain syndrome. Then there is one muscle which runs up here. It's not clearly visible in this diagram, but that is the VMO. So if there is any weakness in the VMO, it tends to track your patella in different direction. So you can see probably that muscle up here. So in the other figure, so if this muscle is not working properly, there is tendency for the patella to shift slightly towards the outside and lead to friction between your kneecap and your femur or your thigh bone up here. So, and I guess you guys have already seen the iliotibial tract or the iliotibial band, which is up here. And yeah, so that's the basic anatomy I think that you should know before you start with any of the exercises. Okay.
Just close that. All right.
Perfect.
So I think the biggest thing we want people to take away is that just because you have knee pain doesn't mean you have to stop cycling or give up cycling.
Correct.
Almost all, unless there's something structurally wrong with your knee, there's always a corrective thing that can be done to fix it and get you back to being running or cycling without pain. Like these exercises or activities shouldn't hurt typically.
No, they shouldn't.
So then what's the number one mistake that keeps, cycling pain around, or what keeps people doing it, and how can we actually prevent that from happening?
So first thing I would say, like proper warm-ups. If you don't do warm-ups, it can definitely lead to injury in your muscles and your other tissues. The second one would be like, despite of having tightness or having muscle pain, you don't seek any help and just keep on working. Like, you push yourself too much that, okay, maybe this pain will go away. So like when you ignore it, it can lead to
So, and we talk about, even before the webinar, we were talking about how a lot of times people will just stop. So it's not overdoing it, not stopping, not being sort of the weekend warrior, all in or all out, but just find that source to make sure that you can treat the problem, correct it, and then get back to doing the activity that you love, whether it's cycling or running.
Any activity, actually.
Perfect. All right. Well, so it's active time for everybody. So three stretches to help alleviate. So I think what maybe might be best to do is show the exercise, come back, talk about it a little bit, and then go back into the next one, just so we can make sure people can hear us all.
Sure, I'll do that. Okay.
Awesome.
So the first exercise is very simple, and you can do it without any equipment at your home. So I'll be just demonstrating it, how you're supposed to do. I'll try to be loud. Let me know if you cannot hear me. So I'll just go slightly far away. Nick, can you just bend the screen a little? Okay, fine. So now they can see me. So just imagine there is one wall up here. So all you have to do is just take the leg in which you have pain, just put it behind the other leg, hold on to the wall, and try to push your pelvis towards the wall. So that will give you some stretch in the muscle up here, or the iliotibial band. So just imagine a wall here, and all you have to do is try to push yourself in towards the wall. And that is how you do it. So that's the first stretch, I would say. And you are supposed to, like, whenever you do any stretching exercises, make sure you are holding them at least for 10 to 15 seconds and repeat it so many times that it becomes equal to almost a minute. So if you are doing like 15-second stretch, do at least 4 repetitions to get the maximum benefit of it. The second thing, never do ballistic movement, as if like if you're standing here, don't do quick movements or jerky movements, because that can then, instead of helping you, can lead to more trouble or can injure your tissues. So that will be the first exercise without any equipment, and you can all do at home. Okay. The second one is for the rectus femoris, or the muscles in the front of your thigh. This is simple as well. You don't need any equipment for this. All you have to do is hold on to your ankle and try to pull your ankle back. When you are doing that, make sure that your thigh goes beyond your midline. When you do this, you should feel some stretch in the front of your thigh, and that is the rectus femoris muscle, which is basically stretched. And as I mentioned before, it should be for at least 1 minute.
Now, I'm just going to pipe up, because a lot of times you'll see people and they're like arching their back
Yes,
when they
they
do
do
that.
that.
So what's then sort of maybe some of the positioning that's important to maintain while we do that stretch?
So if you see that someone has tendency of arching their back, always do it in front of a wall, because then you will know that if you are going beyond that point. Or maybe I would say, like, you can use a mirror and then practice in front of it, because that will, you get your visual feedback, they say, right? That you see yourself and then try to correct.
And this will help make sure we're hitting the right muscle, not sort of cheating by hitting something else.
Yes, or then you can injure your back instead of helping your knee.
Perfect.
Okay. And that will, then it will be the third one. It is mainly for those people who are avid runner, or maybe, cyclists. They usually have extremely tight IT band, and when you touch along, like, on the lateral part or maybe outer part of the thigh, you can definitely feel some stiffness around here. So for that, we use a foam roller, and I can show you here. So this is the exercise that you do on a mat. You don't do on spongy surface. Always use a foam surface. So all you have to do is keep the middle part of your thigh on the roller like this. For those people who are new to this technique, always keep your knee bent. Have your both arms up here, and then roll yourself up and down. Always make sure that you're hitting the right muscle. You're not turning your body, that you hit, you roll onto the anterior part or the front of your thigh.
And we don't need to go all the way down to the knee, correct?
No.
And why is that?
So mainly, it then causes, again, the friction between the band and the femur bone or the thigh bone, which was the reason behind your pain. So
Right.
you don't want to hit that.
So if you go too low, it'll actually make things worse, because
Yes.
we're not rubbing on the muscle anymore. We're actually rubbing
Correct.
on the tendon.
Yep, exactly. And basically, for those people who use one of these rollers, they definitely feel the tightness, and you roll along the range where you feel the maximum tightness, and then you roll along that. Yeah. So that will be the third one.
Are there any questions about those 3 exercises so far from anybody? They're fairly basic, but they're important ones to really
Yes.
that everybody on a bike should be doing.
Correct.
We've probably all seen those exercises or stretches in some variation before, but doing them all together is really important to prevent that knee pain.
Yes, it is.
Now, so our number 1 magic exercise, right? Because that was the one thing so there's one sort of thing that, we discussed was a really, really powerful. We talked about that VMO muscle. So what's our number 1 magic exercise for eliminating knee pain?
So yes, it is basically to hit onto your VMO muscle, which is usually weak in most of the patients with knee pain. And I'm going to show it on one of our machines here.
Maybe step a little closer to us too.
Should I?
Yeah, you're good. You're good.
Okay. So I'm just going to put my eye into it. And yeah, I'll just turn it on. And then keeping your knee bent, and then I'll try to push my knee back. So that is how, when I'm doing the end range knee extension, it hits the VMO muscle. And always make sure that you're not, again, arching your back, or maybe just using your muscles of your hip. Make sure that you're using your knee muscle.
So you should feel this in your thigh muscle,
Yes.
so on the inside part of your thigh there. That's where we
Correct.
want to feel it. And so we're using our actual functional equipment here, but at home, people could do this with some TheraBand
Yes,
or something
definitely.
along those lines. There's some variation. You can also do it like laying on the floor with a
with
a
a foam
roller or
roller
something like
or
that.
something.
So
Yes,
if
definitely.
people want to get more specific details how that, they can contact us and we can help you to get that
For sure.
get that sorted. So
Yeah.
okay, so that VMO though, getting that exercise going is what's going to make the biggest difference for in terms of getting that muscle activated and to
Yes.
really improve that run for people.
Correct.
And that ride. All right, so for me, some of the biggest takeaways from these exercises so far is really that, I know I'm always reminded how that we don't want to roll that IT band the whole way down. I think that's when people first learn about that foam roll, and they're actually like, oh, make sure you can actually see me. Yeah. They're rolling the whole way down.
Yes.
They're like it's we're trying to hit the muscle, which is that TFL muscle,
yes.
just the top of or that first half of the thigh.
Yes.
Right. And then to get balancing out those muscles becomes really important. So should these be done on both legs? If you're just on the pain on the side that's hurting, what would you recommend is usually best?
I would say like it depends on how tight your muscles are, because sometimes people who are right-handed dominance, it depends on the dominance as well. So those people tend to have tighter muscles on the side of dominance and weaker muscles on the side, on the other side, I would say. So you have to balance your exercises based on that. But it is always advisable to perform exercises on both the sides equally.
Right. Yeah. If there are any questions about the exercise or that one exercise in particular, you can let us know in the chat, or when we send out the reminder, there'll be an option to sort of get a summary of some of these exercises as well.
Yes.
All right, we'll go back to Katie for a second here. So what are some of the things that you do as part of your warm-up, Katie, to get people ready for their spin class, and maybe whether they be runners, walkers, or just general cyclists could take away, maybe include with their warm-ups for their riding as well? Because I know I'm guilty of this. When I get on a bike, I just get on and I go. I never warm up before my rides. And of course, I'm always sore, stiff, or things are hurting after as a result of that.
Kind of to your point before, yeah, you can't just leap into it and start going wild, like right in the beginning. Although we have a warm-up track built in, I encourage people to get on their bike about 10 minutes before the ride, just to start moving the body, starting with really low tension and increasing it a bit until they feel maybe a little bit more than that flat road. Obviously, our warm-ups are specific to being on the bike, so just making sure you're not leaping in, going like sprinting up a hill or anything like that. Just being mindful of the body, taking your time with it. Like I'm always clipped in, like I say, like at least 10 minutes before the class, making sure my body's loose and ready to go. And then once we start the class, we have a full warm-up track, which usually includes a hill that kind of builds up moderately, but nothing too heavy and too crazy, or race tracks that are gradually increasing in how steep they are. So
the biggest takeaway is that progressive increase of how things are going, right?
Yeah.
Can we
Long story short, you just
go ahead. Sorry to interrupt you there.
No, that's okay. Yeah. Long story short, you can't leap in and start going wild. Like you have to build to that, or else it's too much of a shock to the body.
And some of these that we did here, the stretches and as well as the VMO exercise, that could be something that could be beneficial to get things going.
Yes. So like basically when you warm up, you do some stretching exercises and some basic strengthening exercises in the beginning, just to warm up your muscles. It helps in bringing in all the blood flow to the muscles that you will be using while exercising or while you're cycling or running, and that thing then helps in reducing the chances of soreness. And I think it's not just the warm up, they also need to do cool down once they are done with their cycling or running or any of the activities they like. But always make sure that you do your warm ups and your cool downs, otherwise you may end up with soreness or maybe some injury to your muscles, I would say.
So we have a couple of things that we're doing. So Nisha's offering a free sort of 15-minute virtual knee scan. So it would just be done over Zoom. You don't have to come into the office. It's nice and convenient. You can stay at home. We really want to make sure that whether it's a runner or a cyclist, that you're getting, we're dealing with this knee pain so you can enjoy those activities, especially with the nice weather being back and warm. We can get out on those bikes and get back to doing some of the exercise that we want to do. So if you'd like to get the free knee scan, get in touch with us. We'll do that.
Sure.
Everybody that's participated in the webinar today will also send you the cheat sheet. as well, that has 12 different knee exercises that are include some of the ones we did today, and then some variations that people can also do at home. It's a PDF similar to what you'll see, actually exactly what you'll see on the right hand side of the page. They'll have some of the exercises that Nish has put together to help prevent knee pain for everybody. So that'll be our hope for everybody here today. Are there any, if there's any questions, please let us know. You can put them in the chat, or if you'd like, we can unmute you and answer the question specifically. If you want to get in touch with us, our phone number is on there. Please give us a call. We will be emailing out a summary of the webinar to everybody as well. But if you have any questions, we are located in the Kenora area, and we're happy to help out with anything you might have. So are there any questions about knee pain, whether it be for running, walking, or cycling, that we didn't necessarily get to today that you still have that you'd like to get answers? It's really important for us that we get those answers. We're trying to really make sure that people enjoy their summer. They're usually so short. I mean, particularly with COVID this year, it hasn't been able to do quite as much as we all wanted. So it's important to maximize this time while we have it.
Yes.
So.
I have a question.
Yeah.
Nisha, you mentioned stretching as part of a warm-up. I feel like I've heard conflicting information about stretching while your body is still cold. So what is the expert's opinion on that?
So I would say like stretching does help. They really say that you need to warm up your muscle before, but stretching within your pain limits is necessary. So it depends on how much are you stretching your muscle, because sometimes you go all the way beyond your limits and stretch your muscle too much, and that can then lead to injury in your muscles. But doing stretches as part of warm up is usually done in the field of physiotherapy, I would say. Yeah, but like it should be within your tolerance limit, and it shouldn't be like a jerky movement or ballistic movement.
It's like, I know for me, one of the things that's always challenging is, you can get pain in different spots, right? So when I was running, I got a lot of what you were describing was pain on the outside of the knee. What about pain in like the back or the front, or like the inside of the knee? What can be some causes or problems that are associated with that?
Yeah, it depends on your history of injury, like how you injured. Sometimes it could be the ligamentous injury that goes unnoticed. Sometimes the cause could be arthritic. Depends on your age as well. So if you are elder, and if you're a younger person, but like if you had some surgery done in your knee joint, that can in future lead to higher chances of getting arthritis in your knee. So
it's best to get it checked out.
Exactly.
Right? Again, don't ignore it. Don't leave it. Don't stop. Just get it checked out. Get a plan, and then and hopefully we get some solutions to that knee problem.
Yes.
Awesome. Well, if there aren't any other last options, the one thing that we are offering, so anybody that books in with Nisha before the end of next week, so it's the 29th today, so by next Friday, the first Friday in August, I don't even remember the date actually, but that first Friday in August, if you book in for an assessment, for a full-on assessment with you, you'll also get a free 1-hour massage from the clinic. So that's a bonus if you get booked in the next week. So something to keep in mind if you want to get that massage as well as some exercise and some therapy. That's the best way to go about it. So we hope you all had a wonderful blast. Thanks so much to Katie Chamberlain from Yeg Cycle for helping us out. We really appreciate that. Thank you to you. Thank you, Nishla, for helping us out. And if there are any feedback on our webinar, please let us know. We'll be sending this out to you guys hopefully in the next little while. All right. Sure. Thanks everybody for coming, and we really appreciated all that time. Sure. Bye-bye.